Hi, I'm Dr. Dana Pecor, the CEO of Pecor Worldwide, a VIP security and threat management firm. Okay, today we're going to talk about point 4. And again, I want to reiterate, and I'm sorry if I'm redundant, but I want to reiterate that this is not a checkpoint list. It's not like you say 1, 3, 4, 6, and all of a sudden we have a violent person or we don't have a violent person. It's just a tool to help us get a better idea in regards to behavioral profiling and understanding the behavior that may escalate violence. It gives us more insight into an individual for the propensity of violence. So, point 4 is substance abuse. Now, let me be real clear. Just because someone has a substance abuse problem, whether that be narcotics or alcohol, it does not mean that they are going to be violent or that they are suicidal or that they are homicidal. But when we do see this type of behavior, and there is some types of substance abuse, coupled with other points of my threat assessment model, it increases the risk that that individual might be potentially violent, and that's what we're looking for. So it's not any one particular indicator, and I just want to make that clear. So what we see with substance abuse, especially with alcohol, is alcohol decreases a neurotransmitter called serotonin. And I'm sure many of you have heard a lot about serotonin. So what happens is when we have this chemical in the brain decrease, serotonin, it also decreases our well-being. And when it decreases our well-being, it can also increase our volatility. And so obviously when there's drinking involved, excessive drinking, we're very concerned, especially if that person owns guns, or they just recently purchased a gun, or they're coupled with hopelessness, which we're going to talk about later in one of the other points. So we start piecing these things together, and we get this intuitive feeling, a gut feeling, that possibly this person is maneuvering more towards volatility. So cocaine and amphetamines, all of this type of drug addiction helps to increase the level of violence. And so stimulants we're very concerned about as well. Okay, so what I'm saying to kind of conclude this particular brief video is try to gather as much information as you can about the individual that we are assessing. Now, one of the things would be, drinking, how much drinking, has it increased recently? Has there been any drug addiction in the past or currently? Are they seeing any type of psychotherapy, some type of therapy to treat this? Because obviously it's going to give us more insight. Again, it doesn't mean they're going to be violent. It just increases the risk, and it's something else for us to look at. And I do want to make one point clear. There was a research study done many, many years ago in regards to alcohol, and it was the one chemical that we did find was related to most homicides. So, doesn't mean that if someone drinks too much, or there's an alcoholic involved here, it doesn't mean they're going to be violent, but alcohol and violence relates together very much so in the world of crime. And that's it for today. Thank you very much, and we'll talk about point 5 next week.